And good morning, everyone. Welcome into a brand new edition of Sports Medicine Weekly on this Sunday morning. So happy you are with us here on 670 The Score. Our website is sportsmedicineweekly.com. I'm Steve Cashel, joined by my usual co-host. He is Dr. Brian Cole, the head team physician for the Chicago Bulls, one of the team physicians with the Chicago White Sox, sports medicine specialist, orthopedic surgeon from Midwest Orthopedics at Rush. And Dr. Cole, how are you on this Sunday morning?
Steve, I'm doing great. Fortunately, we've had some terrific weather allowing us to continue to be outside whenever we need to, so that part's been fantastic.
Well, good. We're going to get it right into it because we have a packed show, but we've got one of our all-star guests on. Karen Malkin is a board-certified integrative health coach and eating psychology expert. She joins us here on Sports Medicine Weekly. We love to have her on. She's our go-to for you and I, personally, Dr. Cole, with our eating and nutrition. And today we want to get into a little bit about social isolation and stress in our emotional state, how it impacts the immune system. Karen, good morning. This is what it's all about these days, right? Trying to protect that immune system?
Yeah, good morning. People are really beginning to feel pandemic fatigue. You know, since COVID-19 hit, I think many of us thought this was going to be going on for just, weeks or maybe a few months. And unfortunately, this pandemic is not going away anytime soon. And so what I'm seeing with many of my clients is low mood, really fatigue and low energy around isolating and complying with the health guidelines of wearing a mask and keeping social distance or physically distance. And it's really taking a hit, and people are starting to really feel just a lack of motivation and a sense of urgency to really follow the recommendations.
Yeah, Karen, it's interesting because just because people are tired of it doesn't mean it's any better, Mm-hmm. And I can tell you that, what you just described is what everyone around me in my immediate sphere, and then extended, I talk to 80 to 120 people a week, at least, just by seeing patients, and it's very clear that 6 months into this, people are starting to, I think, reach the end of their line in certain respects. You have, unlike me, I have a 5 to 10 minute visit in the office with a patient, and I have a lot to cover, and it's very specific to, say, a musculoskeletal condition. But, I've actually had more time with patients to start talking about things beyond what they're there for, and it's been actually very gratifying, but also eye-opening. And you do a lot of one-on-one coaching, and I know also some group things and so forth. How are you tailoring your expertise now and sort of dealing with these emotional issues now with what you normally offer patients, or I should say clients, and potentially, having a positive impact on their immune system? What are you doing from a functional point of view?
Yeah. So in addition to, an anti-inflammatory diet and vitamin D and zinc and vitamin C, I really encourage people to shift their minds and their bodies to a gratitude practice and really think about all that they have to feel grateful for. Because this stress response really has an impact on our physical body. And this research in the field of neuropsychoimmunology shows this clear connection between the state of our stress response and our immune system. So I teach my clients the 4-7-8 breath. I think we've done it together a couple times already on the air, where we inhale through our nose to a count of 4, hold the breath to a count of 7, and exhale through the mouth to a count of 8. And doing this 4 cycles can really help your body get out of stress physiology and into the physiologic relaxation response, which also helps us boost metabolism and digest better and de-stress. And then encouraging physical activity. People aren't going really to the gyms much, but, golf is a great COVID sport. Getting out in nature. When you're living in the big city, we're wearing a mask and there's people everywhere. But if we can get out into nature, we can take off our mask. We can physically distance with somebody else and take a walk or take a jog. That really is going to help contribute to a strong body and a healthier immune system. It's going to improve your resilience, your mood, and your ability to cope with stress.
Visiting with Karen Malkin, our board-certified integrative health coach and eating psychology expert, Steve Cashel, Dr. Brian Cole. This is Sports Medicine Weekly.
Karen, I have a question. What do you think is going to happen when the weather turns with this issue? Because you mentioned golf, and Steve can probably speak to it. I'm not a big golfer, but I have been golfing, a couple times a month, and I'll just do 9 holes, easy to get on, easy to get off, and it doesn't take a ton of time. But it is a stress reliever, despite the fact that I'm awful at it. And, but you get a little bit of camaraderie. You're with other people. You're outside. It has all the elements of things that can sort of allow you to decompress. But, when the weather changes, it's going to be particularly challenging. And you and I are going to have to start coming up with some different strategies to help people manage the same thing.
Yeah, we're going to really have to keep clear boundaries around work and family life and pleasure, because I don't know, for you, you're still practicing and doing surgeries, but for me, I'm often doing virtual coaching, and so I'm home, and so my days and nights kind of mix together, and I need to create my own personal boundaries around when I'm working and when I'm not, because I'm basically accessible 24/7. But I think encouraging families to spend time together, build those relationships with the people that are in your COVID community, and cooking meals together is a great opportunity. I've spoken to so many men who actually are losing weight and exercising and taking so much better care of themselves. No one's really traveling. They're not on and off airplanes eating a bunch of processed foods. So people tend to be eating healthier, which is really positive. They're buying at-home exercise equipment. Peloton has a 2-month wait list. People are getting gym equipment and building gyms in their own homes and doing virtual training sessions with trainers, or there's some great online apps that you can workout videos, I think, are really becoming popular. So most of my clients are making their health a priority around, healthier eating, more vegetables, less processed foods, and a more structured exercise routine, even if it's at home and virtual.
Karen, what are some of the keys to feeding your immune system? How important is that now, especially during the coronavirus time?
So it's very important that we continue to support our immune system by feeding our body with amino acids and proteins, healthy fats such as fish, wild fish, avocados, olive oil, nuts and seeds, vitamins and minerals through our plants, and that's vegetables and fruits, are really going to help the body bounce back when it's under attack. Likewise, processed foods and sugar and excessive amounts of calories and alcohol and caffeine are going to create a more of an oxidative stress response in our body, and also more hormonal swings in the body. So feeding your body with disease-fighting foods is going to be very supportive. That being said, you can't be perfect. So you still want to enjoy the foods that you love. But, I'm the 80-20 girl. 80% of the time, it's phytonutrient-rich foods, lots of veggies, lots of plants. Have a little dessert if you love it, or a drink on occasion. But, really be mindful of some of those foods that aren't going to serve us.
Okay, Karen, great stuff. I appreciate it. Your website again, KarenMalkin.com. You're taking on new clients?
I am taking on new clients. I've got my Thank You Bar project going this summer, where I'm donating protein bars to hospitals across the city of Chicago. So I'm almost done with that project. But yes, I am still seeing clients virtually.
Okay, the protein bars are outstanding, by the way. Thanks, Karen, for joining us this morning on Sports Medicine Weekly.
Be safe. Thanks, Karen.
You too. Be safe.